Medical grade skincare makes me sigh. It does. There are so many misconceptions about it. You're destroying your skin by using any other skincare, that you're wasting your money and you only can use these certain medical grade skincare products. I'm Shauna, certified skin therapist, and I started this series because I'm skeptical of a lot of things, and I've been in the skincare industry for over 10 years, and I'm sure you are. So subscribe to make sure that you follow along and keep up to date with the latest videos so that we can keep this conversation going. What is medical grade skincare? Medical grade skincare is most often found in professional settings, so in dermatologist offices, in medical spas. The claims out there are that medical grade skincare contains higher actives than what you can get on a regular shelf at your drugstore, department store, Sephora, whatever. The other claim is that they are backed by clinical trials to guarantee efficacy, and they are going to be more effective because the ingredients have been studied and designed specifically so that they penetrate the skin deeper and are more effective. Those are the two main claims. Medical grade skincare is a term that has just been given to the category of products. It is not a regulated term. It is not a designation given by any regulatory bodies. It is essentially just a group of skincare that companies who formulate this specific kind of skincare will only sell to professionals. Medical skincare has to abide by the same regulations as any skincare product on the market. There's no specialty exceptions to these products. The ingredients they use, the claims they make, all have to fall under this umbrella of general skincare that is sold on the general market without a prescription. Otherwise, it would be considered a drug, and that would require a doctor's prescription. And a lot of the brands out there you might recognize, SkinCeuticals is really common, is clinical. Why isn't it sold everywhere? If it has to fall under the same umbrella as all the other skincare products out there, then why is it only sold at specific spas and clinics? A lot of these companies formulate their products at higher percentages, possibly the highest percentage of active ingredients that you could formulate a skincare product without it being a drug. Most often they put money behind clinical trials, and not always, but often there are a lot of research-backed information to these products. And so with all the money being put into these products, of course, selling it at a higher price point under professionals is a good way to sell it. It also ensures that the general population isn't just buying these products and not really having guidance on how to use them. And really that's the key, is that when you are dealing with products that are formulated with higher percentage of actives, with maybe a skincare line that uses many different ingredients, many different actives, brands want to ensure that they're being used properly so that the person that's buying them is getting the guidance from a professional in order to use them properly, and also so that they can ensure they're getting the best results. And that looks good on the company, of course, because they want everyone to be getting the best results from their products so that they can, of course, sell more products and the whole cycle continues. Now, I'm not opposed to this whatsoever. I think having professionals guide you to figure out what products work best, how to use them properly, when to use them, I think that's amazing. I think it's really important, especially when you are using a lot of active ingredients. We're talking retinols, vitamin C's, acids. All of these ingredients can benefit from extra information, extra guidance, so that you don't just mess up your skin like a lot of people have out there. But just to reiterate, there is no magic regulatory body saying that this is medical grade skincare and this one's not. So the question is, will you get better results by using medical grade skincare? So we've already talked about that. It might have higher percentages of actives. It might have more clinical trials showcasing efficacy. The products are most likely formulated and packaged appropriately so that those ingredients maintain their stability, like retinols and vitamin C's that can be very unstable. And so, of course, all of these things are definitely moving the needle in the right direction, saying that this skincare probably is going to work better than maybe this random product I just bought at my local Sephora or Shoppers Drug Mart, Walgreens, wherever you are shopping, your drugstore. It's not guaranteed, and it doesn't mean that you can't get similar results by using other products. And there are plenty of really well formulated, well tested products on the market that are not medical grade. Many brands are spending the time and the money to have these studies and the research behind the ingredients so that they can actually produce good products. But it does require a little more research on your part as the consumer to figure out, am I buying a product that is going to do as it says to actually get the results that I desire? Another point that is really important to mention is that because medical grade skincare is sold in these professional settings that often, most likely, also offer treatments. So we're talking either it's a cosmetic treatment, lasers, IPL, peels, microneedling. All of these things are meant to work with your home care. And so as a esthetician, as a skin therapist, as a dermatologist who are offering these services, the idea here is that the treatments in the office have to be maintained by the products that you're using at home. And so these medical grade skincare products are going to be always most often hand in hand with what's happening in the office, which is ultimately going to be getting a better result in the long run. Everything that I'm speaking about now is really more specific with active ingredients. So will a medical grade vitamin C serum, say, let's take the SkinCeuticals L-ascorbic acid vitamin C serum. So this one has been studied extensively. It is touted out there as one of the best vitamin C serums on the market, or at least it used to be, and it has studies to back it up. That vitamin C, it is L-ascorbic acid, which is highly unstable, but also studied as one of the most effective forms of vitamin C. Many people cannot tolerate L-ascorbic acid, but for those who can, this one is a really good option. It is formulated with other ingredients that are going to ensure that stability as well. It is using a form of vitamin C that has been studied to actually penetrate properly and well to ensure that it's going to do what it says it's going to do. So all of these things, of course, become factors when it comes to these products, and which is why you're going to pay the price tag that you're paying. So at the end of the day, should you be guilted into using medical grade skincare because it is the best and superior and better than products that you find elsewhere? No. Should you be skeptical if someone is trying to tell you that you have to use these 3 products that are going to cost you $500 and you have to buy them every single month in order to get the results you're looking for? Yes. Can you get results from other skincare? Yes. Do medical grade skincare products work effectively, maybe more quickly or more efficiently than others? Possibly. It's really up to you to talk to your professional who might be selling you these medical grade products. We're gonna rein in these things here and say that medical grade skincare is not prescription skincare. It still is the same regulatory body. It is still grouped in with all the other skincare products out there in terms of what it can and cannot include. Do I think buying skincare from professionals who have actually looked at your skin, talked you through it, know your skincare routine, know how certain products are going to interact with other products, do I think that's beneficial? Absolutely. And so at the end of the day, I think that's the main takeaway here. Is a moisturizer just a moisturizer? Oftentimes it might very well be. But let's put our thinking caps on, okay? So when you're being told that you have to spend $200 on that moisturizer, let's think about that for a minute and say, is this really worth it? When you're thinking about your more active ingredients, vitamin C's, retinols, acids, you want to be a little more choosy and picky on the ingredients and the products that you're choosing. Is the ordinary retinol gonna have the same effect as the retinol from SkinCeuticals? Most likely not. So let's consider this the next time we're buying skincare. I remain to be skeptical. I hope I answered some of your questions about medical grade skincare, that it is not some special case out there that is this special holy group of products that has a special category. They are not drugs. And it's not regulated. There may be many different companies out there claiming to be medical grade skincare. And what does that mean? Nothing.